Hello, Jantans and Jantanites. I'm Jason Desmond from the Jantan Collective, and welcome to another edition of What's Up With That, where we question, we learn, and we grow. Quick one though, remember, subscribe, like, and comment because we want to hear from you. Anything that you think that we should be talking about, or if you have a comment on what we have talked about, do let us know. We want to hear from you. Now, the big thing is right now, is beauty just skin deep? I mean, life and technology has gone so far ahead already. We can fix almost anything medically. So why not cosmetically? And why is it still such a taboo? What's up with that? Seriously. To walk us through all of this, we have an expert on this. And let me just put it this way. When I first saw him, I was like, wow, he's young and he is a doctor. Let me get his name right and also his qualifications. Dr. David Wee, aesthetic doctor who specializes in non-invasive aesthetic medicine. Dr. David Wee, welcome to the show.
Hello JD, how are you?
I'm good, and I gotta check something with you because on the website, okay, I'm checking Premier Clinic, right? How did you get into this? I mean, out of all the different fields of medicine, why this?
Alright, so aesthetic medicine has been very, very revolutionary. It's something that's always evolving compared to other branch of medicine, where he has always been relatively quite slow progressing. Alright, so basically for myself, I started this journey as a patient. I actually suffered from acne and also certain scarrings myself.
Right.
And also during my growing up, I was also partly, occasionally teased as a kid. Some nicknames they gave me was like Bota, or certain in university call me like Pui Pui, means fat.
Right.
Things like that. So I feel that...
Were you fat when you were a kid?
I guess I was.
Right, okay.
Alright, so basically, I'm going through treatments for acne scarring, trying to read up the latest treatments on weight loss, healthy aging. So basically, somehow I find the passion in this field. All right, and the best part of this field is that it not only benefits yourself, it's something that you can actually share with your patients, people around you, to actually help them to not only be healthy but also to bring the very best about themselves.
Right.
With the knowledge of skin dermatology, and of course with various conference and also the latest update, so I find that this field is always evolving. Things that we know in the past is no more applicable to what we know currently. And of course, the results that we can actually produce and give our patients is so good that most people will actually benefit from it, from various age group, various ethnicity, various issues, regardless health or even beauty. Not everyone will actually benefit from this.
Right. A lot of people always say, doctors who do, the term is plastic surgery, like they always use the term plastic surgery and whatnot, right? They're not real doctors, or they only really worry about your face and everything. They don't really know what's going on inside. But you do. You actually did a proper...
Yes.
You have a proper degree in medicine, right?
So yes, basically, there are a lot of cases where aesthetic treatments is done by people in the beauty industry that are not qualified, or people who do not receive proper training in this field. With the latest Ministry of Health legislation, so we are actually supposed to actually undergo certain criterias, trainings in order to practice safely.
Right.
All right. So basically, what is done to a patient is not just by simply look and see and also like based on what patient needs. It's actually all backed by science proven treatments that actually would benefit someone.
Right. Did you get into this field mainly because of yourself also, and then you saw that it could work, and then also like, wow, there are a lot of people out there who could really use with some, cosmetic surgery, cosmetic help and everything?
I feel that of course, the treatment make an impact because I saw the difference in it. But as a kid, when I want to be a doctor, the intention was always to help people. So I noticed that the positive changes to a person's mentality, psyche, their emotion, as well as confidence, I can actually help increase their self-confidence a lot.
Yeah.
So that is why I feel that this is a field worth pursuing. a difference maker in people's life. Yeah.
Yeah, I see what you're going at because sometimes it's not just about beauty, right? Some people could have had an accident or something and then
Yes,
they need to
exactly.
fix some stuff and everything. They might not want to go out in the world. But how did it work for you? At what point did you feel like, oh wow, this fixed me up? I feel more confident.
I feel that I'm the type of person who likes to progress, who likes to improve. So when aesthetic medicine came into the picture, so I was like thinking, why don't I try it out? So it's something that can help to improve my my overall appearance. So basically, this is why I actually tried this treatment.
Right.
All right. Little do I know that actually this treatment actually make an impact later. And yeah, who I am today was part of how I grew up, how I actually did this procedure, what I benefited from it, and it creates a passion in me.
So you got into medicine not because of cosmetic
Aesthetic,
surgery, right?
no.
You got into medicine because you really wanted to get into medicine.
I get into medicine because, like I said, since young I want to help people. I want to be a difference maker in the society.
Right.
All right. So yes, I mean other fields of medicine is equally beneficial to the society. But however, I feel that this is an area which I feel that it's emerging field which people apart from being sick, they can also, healthy people, healthy individuals, young and old, can actually can benefit from this industry and this field. Yeah.
Because I think, because you yourself saw the benefits of it, right? And I love that. The thing is, for me, in Malaysia, and to be honest with you, in Malaysia, it takes a while for things to happen because there's a lot of taboos all over the
Yes,
place.
correct.
But we always ape the West. We look at this country, we look at that country. Like, tattoos are less taboo nowadays. More and more
Right,
people
right.
are having tattoos.
Correct.
But we love K-pop culture so much.
Exactly.
And watching K-dramas and whatnot. In Korea, people go through cosmetic surgery and aesthetic surgery quite a lot. Do you think it's still quite taboo in Malaysia?
So in Malaysia wise, the taboo is still there, but overall the men and women have been embracing the changes, and they are more open to treatment to actually improve their overall appearance, whether it's a minimally invasive aesthetic treatments to all the way to plastic surgery. So I feel that people are more open to it nowadays. It no more being looked as a taboo. Of course, there are still people who are still afraid. Of course, there are people who actually see a lot of negative outcomes from this treatment. But nonetheless, done right, this procedure is actually very safe. It's actually very natural. All right, and most of all is, of course, it's for almost everyone.
But sometimes you also see a lot of cases where the results not exactly what they were hoping for. Maybe the person who actually got the surgery feels great, but then other people look at it like, whoa, what's going on there? So there are a lot of people out there who are still against, as you mentioned, beauty treatments, cosmetic surgery and whatnot, right? They probably go like, I'm going to go with whatever God gave me, and that's how it should be. What do you think about that, though? I mean, like, we shouldn't alter how we are because that's going against nature and stuff like that.
That's a very interesting question. So basically, yes, there are people who come to me and say, Doctor, I just want to be natural. I just want to be myself. God given me this DNA and I want to embrace it.
Right.
And I often actually agree with them. All right.
You really?
I agree with them that they do not need to do much. That they do not need to like undergo certain like cosmetic surgeries and procedures.
Right.
Even a simple healthcare advice like losing weight, eating healthy, sleep early, taking care of their skin from the sun, things like that can actually benefit them to actually age gracefully. But of course, for this group of people, I also advise them on what aesthetic procedures would be minimally invasive, would give them certain benefits while being natural. All right. So for me, wise, aesthetic medicine is actually to help you look better without altering your overall experience. Natural is always key.
What is because you mentioned minimally invasive, right? And then sometimes you hear non-invasive, minimally invasive, and then obviously there is invasive, which is very invasive. Where does everything fit in? How, at what point does it become invasive, non-invasive, you know?
All right. So, for example, I take a patient like you, JD. All right.
Oh, no.
So
Okay.
basically, if someone comes to me and say, "Doctor, I want natural. I don't want to do any treatments, and I want just to be myself." All right. So I always advise you on your lifestyle. For example, if you smoke, please don't sleep early and things like that. Apart from that, I also advise you on, for example, non-invasive treatments. What are non-invasive treatments?
Yeah.
So non-invasive treatments are treatments that actually do not harm the skin. Okay, and they do not actually penetrate your. They do not break your skin barrier. So basically, things, for example, like using certain non-ablative lasers. These are, for example, like a certain wavelength of lights, which at certain frequency helps you to stimulate collagen, or helps you to improve your blood flow to the skin,
Right.
even to certain wounds or even to the hair. Certain non-invasive treatments, like for example, like chemical peeling. So basically, chemical peeling is where we put certain solutions on the skin,
Right.
where they actually, with different solutions, they give you different benefits, like for example, brightening, anti-aging, maybe a small degree of peeling.
Okay.
All right.
But that's non-invasive.
That's
right?
non-invasive.
Okay.
Minimally invasive is like, for example, like if you come to me and say, "Doctor, I want something to make my skin glow. I want to improve the my hair loss." All right. So minimally invasive is where we use certain treatments which actually just penetrate the skin barrier, just on the very outermost of the layer. For example, like if we do PRP, platelet-rich plasma treatment, where we inject the hair or even the face with this solution to promote healing, to increase collagen and also elastin in the skin. So these are minimally invasive. So not invasive, the skin barrier is left intact.
Alright.
There's no damage to the skin barrier. Minimally invasive is there is a damage to the skin barrier, but not at the layer that is deep.
Okay.
Just at the outermost layer of the skin. And of course, with invasive treatment, then that would be, of course, like surgery. Certain treatments that are like, for example, like subcision, deep chemical peeling, and things like that.
Okay. So when you're actually cutting in,
You're
then
cutting
it's
in, you're going
invasive.
in, you are going to explore certain like structures deep inside and things
Okay.
like that. So those are invasive. So minimally invasive, when a patient leaves the office, they normally look like themselves. They do not appear like something has been done.
Right.
Okay, like no downtime treatments and things
Minimally
like
invasive.
Not
And it
invasive.
heals immediately?
that. Yeah, you don't normally see any difference and things like that. You can actually meet people and of course go to your
Immediately.
normal daily life
Okay.
immediately. So yeah.
Interesting. Now, do women go for cosmetic surgeries more than men?
So, aesthetic industry is more dominant by women.
Okay.
Mostly women seek this treatment. But since I very first practiced aesthetic to probably after COVID, I feel that the trend is already changing. I used to see probably 9 women and 1 man during the early years. Now the ratio is more of like a 6-4, 6 women and 4 men. Alright? So it shows that actually men are also looking for things to actually to better themselves. So yeah.
To fix themselves,
To
is
fix
it?
themselves, yes.
So what do you say to men out there who keep saying, wow, this is not only for women, no, I don't need anything. I'm fine the way I am. You know, receding hairline, droopy eyes, and I don't know, whatever, more bigger stomach and all this kind of stuff, you know. What do you say to them?
I would say don't be afraid. I would say come in and have a chat with us. Yeah, and I believe somewhere deep inside, I'm sure everyone has something that they want to be to improve. Whether is it their appearance, whether is it how they actually feel, or is it something to actually boost their confidence, or even sometimes they just want to try out certain treatments. I mean, yeah, don't be afraid. Just come, have a chat with us, and see if whether aesthetic treatment is for you or not.
So you said that the number of men who've gone to see you went from 10% to 40%.
Exactly.
What do they usually get? What kind of treatments?
So basically, for men, for women, they always want to look good.
Yeah.
But for men wise, they not only want to look good, they want to feel good as well. So basically, to look good wise, men, they're normally concerned on, of course, a few aspects. I would say the 4 lines that is actually quite important to them. The hairline, the eye line means the area around their eyes, the jawline,
Okay.
and also the waistline.
Right.
So these are
That's
areas.
great. I love the 4 lines.
Yes.
Okay.
And also they also want to feel good in the sense that as I know women they have all these hormonal changes during every month and things like that. But for men wise, the changes are more gradual.
Right.
As someone grow older, for example, if you grow after the age of 30, your testosterone actually drops 1% per year. That leads to changes, for example, a losing of muscle mass, for example, decreased confidence. Your overall, you feel fatigue. You feel that yourself that you're getting more tired, more than normal. Of course, for example, sexual health as well. You do not feel like you were once you used to be. All right, and this is normally seen in men after the age of 40. How old are you?
43.
All right. So yeah, so
Okay.
basically, men, they also want to feel good about themselves also.
Yeah.
So these
Yeah.
2 aspects, I feel, is the reason why they actually come into us to talk about us. And in Premier Clinic wise, we are actually quite. We have this program called Premier for Him, where actually we expertise in the needs of men. All right. So basically, whether it's sexual health, whether it's a physical appearance, whether it's hormonal related andropause changes and things like that.
What do you mean by sexual health? Like, how do you fix that?
All right. So sexual health is
Sorry, I focused on that. Okay, my mind just went
all
there.
right. So sexual health is something that a lot of people step into the clinic, even young people, but mostly, of course, after the age of 40. So a few things they come to me and they express their partner complaint that probably the sexual performance is no more longer how it used to be when they were younger. They couldn't last as long. It wasn't as hard as before.
Right.
Okay. And of course, so sometimes they say that, doctor, I do not have the mood anymore. Probably due to stress, probably due to something in their mind, other priorities. So all this relates back to actually aging and of course hormonal changes. So this is one part of sexual health. And of course, with the current advancement in aesthetics, we can actually help them. And of course, we help them quite a lot to actually gain back their youthness from within. Yeah.
So you fix how they feel, their fatigue.
How they feel. For example, you say that, doctor, I cannot get a good erection anymore.
Yeah.
Or doctor, things like that. So we can actually do certain
So
treatments.
you can fix that.
Yeah.
Oh,
All right.
I thought it was like, okay, sexual health because I want a bigger penis or something like that.
For example, that is one of the concerns of many
Oh,
men.
serious? Okay, cool.
Yeah.
So you do all that, like sexual health, and make it firmer and everything.
From
Also, and
the
I want,
emphasis of the functional part of it as well.
I want a bigger schlong. That you can
Something
do
like
that.
Yeah.
One of the biggest concerns, though, that a lot of men feel, actually not just men, everybody feels, people who are very concerned about not getting cosmetic surgery is because they see a lot of bad examples of cosmetic surgery. I mean, these are famous people, right? Donatello Versace, for crying out loud, okay? These people can afford the best, and still, it went south, basically. What happened? How do these things go bad with all the money that these people have to spend?
So this is also a very, very, I think, a negative aspect of the beauty industry, the aesthetic medicine industry, where people get treatment that is not unnatural. People pursue things that are not suitable.
Okay.
So basically, for me as a practitioner, I always tell my patient that what I'm doing here is just to help you to age better, to enhance what is uniquely yours, and of course to try to minimize the negative aspects. For example, if you look tired, you look sad, and things like that. So everyone's journey in aesthetic medicine starts like this. They just want to get a bit better, look healthier, look younger. But along the way where they see the positive changes, they get addicted to it. And of course, when they get addicted to it, they start seeking treatments from too many doctors, too many different opinions. They start doing procedures that are not well suited for themselves. This could be, for example, nose job, or probably maybe a chin job as well. So basically, treatments like this, if it does not suit a person, all right, and this person and they should do it. So eventually they will actually have this negative appearance of, for example, I would say as I call disfigurement
Yeah.
to their appearance.
Yeah.
All right. So of course nowadays we are living in the world of selfies, social media like Instagram.
Yeah.
So we see celebrities, Kim Kardashian kind of post where he actually like promotes, like for example, overfilled lips.
Yeah.
Or certain maybe male models which actually make their jaws so angular and so sharp.
Yeah.
Or maybe, for example, in China, where they actually do implants over their chin to make it so sharp. So basically, with these celebrities, these prominent people doing these treatments, it actually actually somehow deviates this beauty perception to something very artificial, very unnatural. So this is actually the case. And when more people seek this unnatural appearance, this is where treatments like overfilled lips, overfilled jawlines, chins happens, and eventually, yeah, that's why you see people that do not look
Natural.
natural.
Yeah.
They look totally
But
distorted.
shouldn't the doctor tell him that no, as a doctor, because I'm not just some quack who's actually going to cut you up and make you look this way. Shouldn't the doctor say, look, I think you've done enough? It's like a bartender, right? If you're someone drinking at a bar and then you're drinking and then after that you want one drink, it's fine because it makes you feel good. 2, it's fine. 3, the moment you start getting drunk, the bartender says, I think you've had enough. Okay, maybe it's time to go home. Shouldn't the doctor do that?
In my practice, I always discourage patients to overdo their face, all right? And I believe most doctors do. But when patients get unsatisfied, so they would eventually find someone that will do things for them. Of course, if they cannot find a registered doctor to do it, they'll go and find beauticians or probably certain unqualified surgeons to do this treatment for them, all right? So my advice to everyone in this industry is actually to embrace the natural and of course to reject the abnormal.
Are there different treatments for the rich and for the less rich? So the rich can get more expensive treatments and then guaranteed to make them beautiful, and then the less rich can only go for
A very good question. So basically, yes, aesthetic treatments ranges in its range of the pricing from something affordable to something more expensive, but I never see it that way. I only offer treatments that the patient needs. A treatment that they benefit from it, all right? So if, for example, I see someone who couldn't afford the treatment, either I offer them an alternative or ask them to save up for it, all right? Aesthetic treatments, I do agree they are not necessarily cheap, but so do a lot of things in our life. For example, if we go traveling, we invest in certain hobbies, we go to restaurants and things like that, we save up for it. So if there is certain aspects that you want to improve, and for example, you do not have the money for it, you can always save up for it. And when you're ready to do it, you can do it. So very often I see cases of hair transplant where men, they want to actually improve their hairline. And the treatment is actually not cheap themselves. It costs probably about 10,000 and above for this treatment for hair transplantation.
Okay.
So what I would offer them is I'll just give them a few guides on how to actually maintain their hair so that they do not shed faster. And I ask them to save up for it if they're really keen to do it. All right. So I do not prioritize that, for example, the rich can only do this or the poor can only do that. For me, it's only whether is it the right treatment for you and whether the treatment benefits you. That's it.
I want to get back to all the other treatments
All right.
that you guys do, that you have. Because earlier you mentioned about penis enlargement and everything. Do a lot of men go do this treatment?
All right. So basically, penile enlargement or enhancement is one of the most asked treatment in premier clinic. All right. So basically, a lot of men, they feel insecure. They feel about the size of their penis. Whether is it since young when people make fun of them, or probably when their partner says that it's small. Or for example, when for example, if porn is everywhere nowadays,
Yeah.
right? So when they watch it, and people has been making like 8 inch is the new norm, and when they look at themselves and they feel
8? Really?
insecure. So basically, yeah. So people always ask about this. It's good that they come and ask instead of they go and find various methods to actually enhance this area, and causing a lot of permanent scarring, permanent disfigurement over this area. So apart from, penile enhancement, I do see a lot of people who come in to seek treatment to how to reverse whatever they have done.
Reverse?
Yes. Yeah. So basically, yes, penile enhancements can be done, should be done by a doctor, and should be done safely and rightly. All right.
So you guys do it though?
So yeah, we do it. So basically, penile enhancement is a procedure, a method where we use hyaluronic acid or certain fillers to actually inject to a certain layer, which is safe, and
Okay.
to actually increase the size. You can actually increase the girth, which is the diameter, also increase its length as well.
How do you
to a
increase the
certain-
length? How does that work?
All right. So
Sound like a transformer.
all right. So basically, the panel is actually quite flexible and elastic.
Yeah.
So by putting volume into this area, so first of all, we increase its girth.
Okay.
All right. But when this area has reached its potential of its girth, it starts to be a bit longer.
Yeah. Oh, right. Okay.
Okay. So do not expect results like, for example, surgery where you put implants into this area, then you get maybe like double your size. But you get probably an inch or probably half an inch longer, which is actually quite good.
Okay. And it still works fine.
Yes, it still works fine. So the important part is not only this enhance its appearance, it works better, and of course, natural.
Okay.
All right. So as I said just now, penile enhancement is a procedure where we actually inject certain fillers into a safe layer. This actually very safe, very fast, and of course minimal discomfort. Most of my patients say that, they're surprised like in about 15 minutes or 20 minutes the procedure is done. And the result is of course instantaneous. They see the difference immediately, and there's no downtime.
Earlier you mentioned some people try to reverse it.
Yes. So I do see a lot of men who actually, a young, probably village man who actually wants to get this treatment done. They don't have the proper access to probably a doctor, a proper clinic that actually do this kind of treatments. So they actually seek various, maybe they go overseas or they go to certain treatments in the hotel room where they do various weird treatments, like they put some oil, they apply something, they consume some medication.
Yeah, I was
inject
about to ask
something
you that. Other medications.
and
Yeah.
things like that. And somehow what happened is, very often these things are not safe. Very often these things, though it look for a brief period looks good, but in the long term, it gives a lot of disfigurement to the panel. So for example, I've seen someone who actually injected their panel with, I think, some kind of cooking oil or some kind of
What?
some kind of
Why?
silicone-based products. So what happened is, over a period of time, it clumps together. When it comes together, it looks weird. And these are the people when they are desperate, when it looks weird, the wife is looking to, for example, to divorce them inside, then they feel very desperate. Then they continue to do various many funny things, and it continues to get worse and worse and worse and worse and worse. So
But those are the dodgy ones.
the dodgy hotel-based treatments, or
Alright,
probably
right.
sometimes saloons, or probably like in overseas where treatments like this are not properly monitored, not
Right.
properly. Yeah.
Okay. So yours, there's no medication to take or anything at all?
So I do advise certain supplements to actually improve your overall health, to improve vessels flow.
Yeah. Because vessel flow means rigidity as well, right?
Exactly. And of course, I do encourage a certain lifestyle to adhere to, like for example, to stop smoking, to reduce your sugar intake, try intermittent fasting, things like that. They actually help you to regenerate your body.
Right.
So yeah, you will actually benefit
Okay. Because when you're driving anywhere around KL, or I'm sure even other parts of the world or in different states, and you're at the traffic lights or something, you always see this bunting at the traffic light and another thing that says, call this number if you're gonna, and then even online, you see all these advertisements about making your bit a bit bigger or whatever it is, right? Do all these things work to some extent?
First of all, I do not know actually what they do.
Yeah.
There, when you see these banners, when you go to certain adult websites, they promote certain kind of pills, certain
Yes.
kinds of pumps. I'm not very sure how it works, but of course, when it comes to the medical grade devices or the medical grade equipments, it works. So if these websites or these people are using medical grade equipments or treatments, then it will work. But if they're not using these kind of things, then it can actually be dangerous.
Okay.
Yeah.
At what age should? Because generally men, when they hit 40, late 30s maybe, some later, depends. But you start to lose interest or your
Mojo.
libido drops. Your mojo. Exactly, your mojo. Okay, you start losing your mojo, right? Generally, what age is the one that comes to you for things like this?
So most men come to me when they actually lose their mojo about the age of after 40s.
Alright.
All right. I notice a lot of men after the age of 40s, they start complaining about erectile dysfunction.
Right.
Whether they loses the hardness, whether they actually can't sustain as long as they want to. So yeah, so this is
Okay.
normally the age. But of course we do, and I do see that this trend is getting younger and younger.
Really?
I do have patients who, for example, at the age of probably 30 plus, already starting to have this problem.
Why is that? Stress?
So I feel that is multifactorial. So of course a combination of stress, psychology, with porn being there everywhere nowadays, as well as probably the processed food we take, and not taking care of our body, smoking, all actually contributes to reduce performance.
Okay. You mentioned smoking a few times already. Smoking
Yep.
is a big issue, isn't it?
So smoking itself actually causes vessel damage.
Right.
All right. So people who smokes, actually, what happen is the blood flow to everywhere, including the heart, including the penis, right, is affected. So what eventually happens is that the muscles over this area do not get nutrients enough.
Right.
So in the long term, not only they can't last as long, it actually also gets smaller. So this is one thing.
Right.
So yeah, a very good treatment for vessel related problems, the panel would be something called P-shot.
What's that?
P-shot, or we call it as a panel PRP, is where we actually draw a person's blood. We actually process them, we spin them, and we harvest the plasma part of their blood. In this blood, there's a lot of growth factors. One of the key growth factors that we want is VEGF, vessel endothelial growth factor, which is responsible to actually rehabilitate the vessels to so that new vessels may be formed and repair whatever existing vessels there is.
Right.
All right. So, yeah, smoking has a very bad effect towards men's sexual health, and a treatment called P-shot can actually help them.
Okay. I think we've spoken enough about penises already, and very fascinating. If you're interested, go check out the website. We're going to give you all the details later. But what other kinds of treatments are there that Premier does?
Okay, so basically, in Premier Clinic, I do a lot of body contouring. I do a lot of hair restoration treatment, as well as probably facial treatment. So for hair-related treatment, hair restoration, normally I see this in men. All right. Men suffers from something called as androgenic alopecia, male pattern baldness, where due to genetic, they lose their hair normally at the front. They get the M shape, and also on the crown area,
Yeah.
it gets thinning.
That's me. Yep.
So In my family, yes, I do carry this gene where my parents, my siblings, they have male pattern hair loss.
Right.
So that's why I'm very interested in this field. All right. So of course, some of the treatments that can be done would be, of course, hair transplantation, injection of certain growth factors, for example, PRP, hair fillers, or even certain lasers to stimulate the stem cell and to stimulate vasculature so that hair grows.
All right.
So, apart from hair treatment, other treatments that I do is, of course, body contouring. As I said, men are very concerned on their waistline. So, a typical man would want a broad shoulder, a narrow waistline. So, apart from surgery, which I feel is not safe, we do minimally invasive or non-invasive treatment like fat freezing.
Okay.
Fat freezing is a treatment where we actually freezes the fat roughly to negative 11 to 13 degrees, where the fat cells will automatically be destroyed or eliminated, get smaller and be destroyed from the body.
Right.
So I use this to treat the stubborn areas, and the results are very
And the
natural.
love handles, is it?
The love handles especially.
Right.
Yeah. So this is another area of concern. And of course, with the face, I think men-wise, they are not too concerned on the skin quality. They're more concerned on like appearance of tiredness around the eyes.
Right. Yeah.
They're concerned on the negative aspects. Like sometimes certain things makes them look angry, look unfriendly. Probably it's their the wrinkles around their eyes, between their eyes or on the forehead. So things like that.
What about? Because I read that you do stem cell treatment as well.
Yes, we do stem cell therapy. Stem cell is a very new and most promising modalities in the field of aesthetic medicine and of course regenerative medicine. So basically, stem cells are actually a master cells, I would say. All right.
Sorry, Ahmad.
Master cells.
Okay.
Master cells, which actually has the potential to restore, to rejuvenate, to actually repair any cells in our body.
Any cell.
Any cells in the body, yes. So, so that is why stem cells is used nowadays for various medical treatments where a cure hasn't been found yet, or probably treatments are not effective to treat that disease.
Right.
For example, I think Michael Schumacher.
Yeah.
So actually, he had his injury while skiing.
Yeah.
And he hurt his head, and he went to a coma.
Yeah.
So where surgery was done, treatments was done, and they couldn't actually help to get him out from coma. So one treatment that was done to him was actually stem cell therapy, where they managed to get him out from coma, where he's actually awake now, but still in a relative vegetative state.
Okay.
All right. Certain part of treatment of stem cell is, for example, where people have a permanent injury, permanent disfigurement. So back to the topic of penile. So I do have a patient where after prostate surgery, where he couldn't have the penile erected anymore,
Right.
and the wife was very, very distressed about it. So he actually did a stem cell on the penile, and remarkably, it actually improved. So, for example, the wife gave a score from like 0 out of 10 to something like 3 out of 10.
Right.
All right. Though it's not wow, but it's something that it's the future of regenerative medicine, something that we can look forward to in the future to treat things that we couldn't treat at the moment.
Right.
I would say that stem cells is still pretty much premature, but the next 10 years will be very exciting.
Right.
There have been studies that they're using stem cells to treat cancer, using stem cells to rehabilitate patients from permanent disability like strokes.
Do you guys do it?
We do stem cells. So basically in Premier Clinic, we do stem cells, two forms of stem cells. They are mesenchymal stem cells. Mesenchymal stem cells are, for example, cells harvested from bone marrow,
Okay.
or even from a person's fats. So what we do is actually we if it's mesenchymal stem cell bone marrow, we actually procure these stem cells and we inject it to areas which need it. It could be the hair, where if people experience balding. It could be in the penile area where they have erectile dysfunction. It could be even to the face when they have acne scarring as well. And of course, certain people where after they have accident or burn scars, it can be injected for to increase the recovery of it.
Do any of these, I'm not saying just stem cell treatment, right? But when people go to Premier, and I'm not pinpointing you guys, but when it comes to cosmetic surgery or when it comes to aesthetic surgeries, right? Is it risk-free?
So I believe everything we do have risk.
Yeah.
I believe that when one person wants to do something, he or she should be well aware of what are they getting into and what the risks involved. So in Premier Clinic, what we do is we practice a very open approach where we actually be very frank in our consultation. What are the possible risks and benefit for every treatment before any treatment is done? So of course, the more invasive the treatment, the higher the risk is.
Okay.
Hence, that is why for first-timers or someone who does not need invasive treatments like surgery, we always advise them for the non or minimally invasive treatment first.
Right.
All right. And in Premier Clinic, we do lots of them by using the latest state-of-the-art treatment machine devices. We use probably the best fillers and of course, cosmetic products and things like that.
All right.
Yeah, to deliver the results.
So, but when you talk about risk factors, right? The percentage is let's say, you go according to the kind of surgery or the kind of procedure, or also the age of the person that comes in, and the older you are, the higher the risk factor.
It basically depends on what you do. So basically, when someone's old, they come for a treatment that is probably quite invasive, a prolonged treatment, and have something that, and they have certain medical health aspect.
Yeah.
So yes, of course, it can be risky.
Okay.
All right. So in this case, normally we will, of course, advise them for the non-invasive one. Sometimes we will ask them even to go to the hospital to get the treatment done.
Okay.
All right. For young people, the risk normally is not regarding their health condition, but it's about the procedure that they're doing.
Okay.
If they opt for something, for example, a drastic change, for example, liposuction, or they want to do certain kind of implants, which we do not do. Yes, the risk is
you don't do implants?
We don't do implants. The risk is higher where they can actually damage certain nerves, certain vessels,
Right.
causing a long-term problem. So what we practice in Premier Clinic is we advise patient to do something that is safer, minimally invasive, compared to the more invasive one. This is what we specialize in.
Okay. So, Doc, you've been doing this for a long time, right? And you're ethical. You do what you think is needed, and we've been talking about this natural. It needs to look natural, right? But clients will be clients, and clients will say, "Hey, I've got money. I want you to do all this kind of stuff to me, and I want this, right?" What's the most out of the ordinary request you've gotten? Maybe normal to you, but what do you think would be out of the ordinary for us?
I think something, for example, for men, they have scrotum, and their scrotus sac looks very wrinkly.
Yeah.
So basically, they ask for treatments to actually to smoothen up.
Why?
Well, because they want to actually
Make
look
it aesthetically
smooth. Yeah, make it as pleasing as possible. So yes, there's a treatment for that where we actually use
You
botox.
have a treatment for that?
It's called Scrotox, where we actually inject a botulinum toxin, which is something like it's a protein which
Right.
relaxes the muscle.
Okay.
So by injecting just around the scrotum area, then you can actually smoothen it out.
But it doesn't make it function any differently, right? I mean, like,
Nothing. It just looks less wrinkly.
okay.
Imagine something like, for example, a very dried fruit
Yeah.
becoming like a normal fruit. Something like that. It's like
Okay.
less wrinkly.
So I could have a prune, and then next thing you know, I have like a really
yes, exactly like a
look,
prune.
it shines, kind
Yes.
of.
So this
really?
is one of some of the treatments that people do come and ask. No, not common, but yeah.
But
there are some
it's actually fascinating that there's an actual treatment for it.
Yes.
What's it called again?
Scrotox.
Scrotox.
Yes.
Sorry, I thought it's Scrotex, but
Yeah.
okay, Scrotox it is. I'm just trying to figure out why you would do it, because sometimes, for me, I think nature made it that way because when it gets cold, you wrinkle up, right? So it actually protects whatever's inside. But that's fascinating. Okay.
So basically, this treatment is done as people are concerned as when they grow older, and this area becomes the skin over this area becomes very loose and very dry and wrinkly.
Right.
So they want to make it look, for example, a little bit younger, a little bit smoother. So this is why they actually seek this treatment.
Right. Okay. Okay. Do you ever get transgendered people coming to see you and asking for procedures?
Actually, we do receive a lot of patients who are actually transgender. Whether is it to a treatment done to feminize themselves or to, for example, masculinize themselves. Yeah. Apart from that, also transgender do seek treatments about body aesthetics. For example, they want a bigger chest,
Right.
a bigger butt.
But you don't do implants, though, right?
So we do not do implants, but as I said, with the advancement of medical aesthetics, we can actually do filler to this area.
Right. Okay.
So we can inject a certain filler, which is safe, to a certain layer to bring out. Of course, to bring out and give volume to the buttocks as well as to the chest. And though the results will not be as nice or as nice as surgical implants, but they are actually relatively safe and even more natural than implants.
Right.
So these are some treatments that actually transgender look for.
And also hair removal, I'm assuming.
Yes, hair removal is pretty common everywhere. People do not say much about it because it's very private to them. Yeah, but men and women seek this treatment all the time.
Yeah.
Because in regards to any other means of hair removal, shaving, waxing, electrolysis, none of them offer a permanent solution or a long-term result.
Yeah.
They have to keep on doing it. But with laser hair removers, they are not only safe, they do not damage the skin. They give results which, for example, it can be long-lasting. For example, like if someone used to shave probably like the private parts, probably like maybe every 2 weeks or every month once. So by doing lasers, you don't need to shave that often. Maybe you just need to shave or wax probably maybe like you prolong it like every 2 months, then eventually every 6 months, or eventually maybe 1 year once. So what we do is we actually delay the growth of the hair. Yeah.
Right. So again, if you're watching this and if you are seeking treatment like this, whether you're male, female, transgender, and you want treatment at Premier Clinic, we've got a great promo offer at the end. But right now, let's talk about me, because I'm very fascinated by this. And the moment we were talking about this, I was like, wow, you can do all that? That's fascinating. And my producers and executive producers were just talking about this, and they say, I look exactly the same way I've always looked for as long as they've known me. But in my mind, I'm like, wow, I've gotten older. There's some things that I just can't seem to control. I've tried dieting and I've tried working out and whatnot, and the love handles just don't seem to go away. And I don't know, from your point of view, you sitting there, look at me. I'm a mid-40s man. What could be done to me?
So normally in my consultation, I always start with praising and also appreciate one's uniqueness. All right. What's wonderful about you is that I feel that you do a lot of expressions.
Right.
All right. So that's something that I want to preserve. I like the way that you give a lot of contact. So the appearance of your eyes, your eyebrows is unique. So I mean, this is something to actually, to preserve.
Okay.
All right?
So don't do anything to my eyes.
I feel that, for example, if you go to some doctors or some practitioners, you say, JD, you may need a botox because we can start seeing lines coming out.
Right.
But for me, I feel that is unique about you.
Okay.
So that is something that I want to preserve.
All right.
But what I want to help you to actually help you is, of course, the 4 lines that I'm talking about.
Okay.
So basically, let's start from head. So I feel that JD's hair loss he suffered from a male pattern hair loss.
Yeah.
Just looking from the front here, he's probably somewhere about grade 2, maybe to grade 3.
How bad is grade 2?
Grade 2 to grade 3 is actually quite mild,
Okay.
entering moderate. All right.
Okay.
Grade 7, where someone is totally bald. Okay.
Oh, grade 7 is
Totally
Bruce
bald.
Willis.
Yes.
Okay, cool.
So this is something that I feel that for his outlook, he needs to have a good hair, and the way he styled it is quite nice, but he needs to preserve it. So a good treatment for his hair would be, of course, a combination of mesotherapy injectables, where we can actually inject the hair with a few growth factors to maintain it, to protect them, as well as start to take some supplements to ensure that the hair remains strong.
Okay.
All right, because currently when we look at you, the proportionate of your forehead, your nose, and also your lower face is, I would say, quite symmetrical,
Right.
Which is quite good. But if your hairline were to recede more, then it will look unbalanced.
I have a little bit of a patch here, though.
Yes.
Like a little crowning
So
glory. Yeah.
yes, so if you're free, come over to Premier Clinic.
Okay.
We'll do some hair treatments for you.
Right.
So I suggest what would be good for you is a combination of a laser, and if you're open to probably injections, mesotherapy to the scalp. All right. Rest assured, these treatments are actually very. You will be surprised. It's actually very comfortable. The laser's function is so that we shoot the laser to stimulate the dormant stem cells that are actually sleeping to activate to work again. Besides that, we also promote blood flow to the scalp and to the hair. The injections of PRP, which, as I said, we draw your blood, we process them, and we inject. We are using very tiny needles, not the needles that we are, for example, those that we use to draw blood. These are just tiny needles that is barely visible, just to penetrate the skin layer.
Okay.
Because any hair products, any hair solutions that you apply, due to the thickness of our scalp, the penetration is roughly about 10 to 15%. So
Okay.
I think this is a treatment that you can continue to do, to actually maintain your hair, and of course to improve to a certain degree.
So where would you inject though? Here?
No, I would just basically inject over, of course, the full scalp, but the hairline,
Right.
the crown area.
Okay.
That's it. All right, and you should barely feel
And
like
of course, whatever I have.
the patch, empty
Yeah.
patch. So first of all, I would suggest. The hair loss is something that he needs to address. Second of all, I feel that the upper face and the eye is very good, but the negative thing out of it is that sometimes he can look a bit tired. So this is shown by the appearance of a slight hollowness under the eyes.
Right.
Alright?
Here?
Yes, here.
Yeah.
All right.
I
So-
sleep like 3 hours a day.
All right. So depends on individual. Sometimes they will say like, how much you sleep, you still have this back.
Yeah.
So normally I get this from doctors. I myself do have quite a terrible eye bag. All right. So what we
Really?
can do, I used to, but certain treatments can be done.
Right.
To actually volume treatments like hyaluronic acid filler used to actually smoothen out the lines. So what he will actually look is, for example, if he has this eye bag here, we just put a little bit under here, he'll look something smoother, something like this. Alright? So it looks flatter. Alright? Okay. Another thing that he can also benefit his around eye areas is that his upper eyelids starts to his upper eyelids looks quite loose already.
Yeah.
Right? So this is an aging sign where people's eyes getting smaller and smaller.
Yeah, because I feel like I'm just drooping all the time.
Correct.
Is there anything that can be done to?
So what we can do is we can use a very safe laser. Okay, it's called a smooth eye. What we do is we use the heat part of the laser. It's not a laser that actually like burn anything. It's just the heat. All right, which stimulates collagen and elastin so that it becomes firmer and more elastic.
Okay.
This is something very powerful where I have very, very renowned artists or probably certain influential individuals who just come to me just for this very treatment, nothing else.
And just to do this.
Because they do not want to appear tired, sleepy to their followers or to other people around them. So
But it won't affect my eyesight or anything.
it shouldn't. There is almost zero risk to the vision. So yeah, rest assured, it's very safe. So I feel that JD will benefit from a little bit of filler under eyes, a little bit of laser to
Okay.
just tighten upper eyelids. Next of all, I feel that with his beard and of course beard, he has a very nice beard that actually frames his jawline. So I will not do anything about it. All right.
Yeah, the reason why I have a beard is because I have a horrible jawline,
Right.
and then now that's why I have a beard actually.
So some people we do beard hair transplants to
Really?
actually to create this effect as well. All right, but for you is actually
Yeah,
very
because
good.
the funny thing is I'm losing hair here,
Yeah.
but I'm growing hair everywhere else. So I got hair here and whatever because I've got the Indian part of me is coming out, right? But yeah,
If you were to do a blood test to measure testosterone level, I assume it's actually quite on the higher side because testosterone gives the effect of having facial hairs,
okay.
all right, or even body hairs. But somehow testosterone actually affects and also attacks the hair follicles on the scalp.
All right.
Right.
Oh, so it balances out there.
So testosterone has dual effects. All right. So basically, yeah. I mean, of course, you should still get a blood test if you want to check whether is it true or not. But yeah, that's a
my
possibility.
God, testosterone, those bastard hormones. Okay, cool.
So for the face, just the hair and probably around the eyes.
Okay.
And next, I think he's very good looking. He has actually quite nice body.
Wait, I've been told that you were an honest and straightforward person.
but-
That was a stone cold lie.
But what he really likes in his body would be the abdomen area.
That's the honesty part.
I feel that the abdomen area shows that he's happy, but it's not an indicator of good health. All right.
Right, yeah.
So basically, for his abdomen, of course, I need to assess him. I suspect there is a presence of both subcutaneous and also visceral fats.
Okay.
Alright.
What are those?
So basically, these are fat layers in the belly,
Okay.
abdomen. So subcutaneous fats are fats that's outside.
Okay.
Visceral fats are the fats that's surrounding your organs.
Right.
All right. So normally subcutaneous fats couldn't get that big. It's
Okay.
just a limit. But when it gets very big, means that it's both layers. So what you would really benefit would be, of course, a lifestyle modification. You should eat healthy, balance, reduce your portion, and also exercise as well. All right. You do exercise, right?
Sure.
Alright. Okay. Apart from that, also you can do treatments to actually reduce your subcutaneous fats. So this, of course, I'm internationally trained in co-sculpting, and
Okay.
I have a lot of experience in co-sculpting, and I feel that co-sculpting actually help you to reduce your overall bulk over your anterior abdomen.
If I were to do all this and this,
Right.
how long will it all take to fix? One session? Definitely not one session, right?
Definitely not one session. I would say that for your scalp and your hair, probably one treatment every 3 months to 4 months would be adequate.
Oh,
Alright?
serious? Oh, it's that easy?
Yes, it's just for maintenance.
Okay.
All right. And for your eyes, for the under eye tiredness, just a single treatment will be able to last you probably about a year to a year and a half. All right.
Okay.
And for the upper eyelids laxity, of course, you have to start with a more frequent treatment. I would suggest probably every month once, probably for 3 times. Then subsequently every 3 months, then maybe yearly once.
Oh, wow.
Okay, so this, that's for the laser over the upper eyelid.
Okay.
For the abdomen wise, it's very individual. So basically, I believe the health aspect of it have to be practiced every day.
Okay. I need to eat better.
Yes, but the treatment of the subcutaneous fats with co-sculpting is permanent, in the sense that when the fat is being destroyed, the fats does not grow back. It do get bigger, but the fat that is destroyed do not get back in amount.
Okay.
Okay, I'll just summarize that. So, for example, there's a treatment for fat loss and weight loss. What's the difference? Weight loss is a treatment where we treat your overall weight and you see that your fat cells diminish in size, but the amount of fats remains the same. Like if you have 100 fat cells, you still have 100 fat cells, but they are smaller. Fat loss treatment is where, like if you have 100 fat cells, we reduce them probably about like 20 to 27%. So you have probably like maybe about 73% numbers of fats. And your fat cells do not replicate unless you're growing up.
Okay.
So the results are permanent.
Right.
You just need to maintain your weight and the results will will be there forever.
Fat cells, I mean, like, it's not, I'm not supposed to have so much fat cells anyway, right?
Everyone's fat cells is actually fixed over the period of time. It's only that when someone gets bigger or they get heavier, fat cells increase in size.
Right.
The number is fixed.
Okay.
All right. With fat loss treatment, we actually reduce the number of your cells.
Does that affect my health though?
It does not affect your health. Right. So basically, fat cells are important, but excessive fats are unhealthy.
Right.
All right. So for men and women, we are actually it's normal physiologically to have fat cells not less than 7%, and somewhere of a healthier range of probably 8 to 12% would be on the healthier side.
Okay.
All right. When it gets lower than 7%, this is where you start seeing problems with your hormonal changes.
Okay.
You start losing. You start losing functions that fat cells are supposed to do. For example, like protection of your organs, giving you a proper contour to your body,
right.
things like that.
Okay.
So yeah.
How would you say I am? I mean, like, I'm obviously not an extreme case.
I believe that you're actually a very straightforward case, easy to treat if you follow my plan.
Yeah.
So basically, it would be best if I can see you without your clothes. All right. But just by a vague judge, I probably think that you're probably at the range of probably 26 to 28% body fat percentage.
Okay, you want to test it out? You want to check it out directly?
Yes, probably. Come.
Okay. You want me to take off my shirt or
You can. Yeah. Come.
Or let's just not, shall we? Okay, let's just go with whatever I have in my gut and everything.
Okay, all right.
Here.
So, you see, JD used to be very fit. All right, can actually see his rectus abdominis muscle here. All right.
I used to be very fit. I used to play tennis. I still play tennis a lot. Yeah.
All right. All right. But what happens is that you can see that there's also fats that is pinchable around here. Okay. So these fats that's pinchable, these are subcutaneous fats. All right. So if these fats are eliminated, you are able to appreciate JD's six-pack again. All right. And this is very simple. You do not need surgery. You just need certain treatment called fat freezing
right.
or cool sculpting to treat this area.
Okay.
Apart from that, the flanks as well. All right. So the flanks is one of the stubborn fat where I have most gym instructors, models, where they come to just treat this area because it just don't go away.
Yeah.
All right. So this is one of it. And apart from that, JD do have also, you can see from the lateral profile that the abdomen is actually slightly raised up. Okay. And he has minimal subcutaneous fat. Means that he has also a portion of visceral fat which is not healthy. So what I would advise is he still need the part where he exercise and he diet.
Okay.
And
I stopped exercising because of MCO. MCO made me stop exercising, and then
there it goes.
I just started eating non-stop, and it was so much fun eating and not exercising. You know.
Basically, you discover food.
Exactly.
Yeah.
I rediscovered food. Exactly. So now that you've felt me out. So am I around 20, 27? You said what, 27%?
Probably about 26 to 28% body fat.
All right.
Which I feel that is just slightly over. All right. Ideal fat percentage for a man would be, of course, I advise to be less than 24%. So you're just a little bit
less
over
than 24%.
Okay. If someone wants to reveal their six-pack act, they need to exercise, diet to roughly about less than 14% body fats. Better, it would be roughly about less than 12% body fat, where they can actually see the six packs. Yeah, so it's actually treatments are always individual based, where you must be ready for the treatment. You agree with what the doctor proposed to you, and you want to do it.
And discipline also, right?
And discipline as well. Correct.
Okay.
So yeah, so these are the treatment that I propose to you.
Okay.
And do you have any other concerns?
Not really, just scarring from my.
So,
but you don't really see because I've got a beard, right? Yeah, but it's just.
So acne scarring, I believe, is from acne, is it?
Yeah.
It's something very common where acne affects probably 8 out of 10 of every teenage people. And very often they actually leave a mark, and which will follow them for the rest of their life.
Right.
So if you are ready for an acne scar journey, you can actually try a fractional laser. Have you tried fractional laser?
No, I've never tried any kind of laser.
So fractional laser is a treatment which is done using CO2 laser or erbium laser, where they create tiny punctures in the skin.
Okay.
And once the skin heals back, it heals back better. Because by definition of scar, it means an irreversible process. Means just leaving it to be, it will never heal.
Right.
All right. So what we need to do is we need to induce the repair, the healing process again. So a fractional laser is relatively a minimally invasive treatment that is suitable for your scar treatment.
Okay.
And results normally evident from the first treatment. All right.
All right. Okay.
Yeah, so that is quite good.
I'm actually seriously considering this. I think I might drop by the clinic for a little bit of a
Sure.
session. But what's your advice to people who is actually watching right now who are interested in getting some kind of treatment? Do they check the website? Do they come straight to you to get a consultation? What's your advice to them?
So my advice to everyone out there who are interested and seeking treatments to actually improve their appearance or to improve how they feel about themselves, first of all is to choose a licensed and reputable clinic.
Okay.
After that, look for a doctor which you are comfortable with. Come into the clinic, make an appointment and start talking to the doctor. Be very honest about your insecurities. Tell them what you expect, and of course, tell him what expect. Let him know about what are you afraid of in the treatment and what are the possible risks. Of course, let the doctor know about your budget as well, so that he can actually plan something out for you.
Right.
Once the doctor plans something out for you, then work with the doctor on a plan which that you think that you can follow. That you have the discipline and you have the time to follow for the treatment. And if it's all checks, means that you're comfortable with the doctor, the budget is right, the treatment is something that you can actually follow, then you can actually start on this journey.
Right.
All right. What you shouldn't do is you shouldn't rush your treatment. Skincare aesthetic treatments is a journey. It's a goal where you need to have someone qualified to guide you towards that goal. All right. So do not rush towards this treatment. If you see a lot of scary botched results, major complications.
Yeah, there are a lot of people afraid of cosmetic surgery.
Yes, and the negative aspect of it. With the advancement of medical aesthetics, this has been very rare.
Right.
All right. So do seek the right channel for this treatment instead of finding alternatives, like for example to certain people who says they are expert in this field.
Right.
And they're not registered. All right. So yeah, that's my advice to all of you all.
Okay. That is fascinating, Dr. David Wee. Thank you so much for a very, very interesting chat. I will pop by,
Okay.
and I will want to get some work done because
Sure.
I've been upset about a lot of things for a while, and I've kind of let go, right? So
You look okay.
yeah.
Yeah.
What do you want? I'm coming over anyway. You don't have to
Yeah.
bother me up, right? But this has been a very interesting chat.
Sure.
Thank you very much. Tell you what, guys, if you want to find out more, go to premier-clinic.com. That's the website for the clinic. And also, you can check out Dr. David Wee's profile there. Also, we've got a very, very special promo for you. Hashtag What's Up with Premier. That's WHATS up with Premier, PREMIER. If you put in this Premier, this promo code, you will get a 5% discount off your treatments. Okay, so especially for you, especially for What's Up With That fans, especially for What's Up With That subscribers. So I tell you what, this has been a great chat. Thank you for watching. If there's something that you want us to talk about, or if there's something that was about this particular episode that you want to comment about, please do leave your thoughts in there. As usual, don't forget to subscribe, like us, and also if you want to get notifications, click on the little bell button and you will be notified. Thank you so much for watching. I'm Jason Desmond. This is the Jantan Collective, and this is What's Up With That. Remember, as always, guys, Jantans, Jantanites, don't be a dick.